our participants are current Europubhealth students, these sessions are also open to all public health students and professionals. So feel free to share our upcoming events with those who might be interested. Today's session focuses on HIV/AIDS, a global health challenge that remains highly relevant. And I'd like to extend my gratitude to those who made this event possible, especially to our in-house HIV expert, Marco Barracchia. Thank you very much, Marco, for co-organizing this activity, as well as our student experience officer, Samia Garcia. Samia, are you here?
She's in class, so I'm not sure if she's going to be able to answer right now. But she's
Okay.
with us. She's with us.
Yeah, but thank you very much, Samia, for organizing this event, along with the rest of the EPHSA team. I forgot to introduce myself. I am Bonnie, the president of EPHSA. A special thank you as well and warm welcome to our guest speakers, Marco Bastian Stizioli. Hello, Marco. I hope
Hi
I pronounced
everyone.
it correctly.
Yeah.
Yes, thank you,
So
thank you.
yes, thank you, thank you.
As well as Elaine Becks Nininahazwe. Hello, Elaine.
Hello, Bonnie.
Uh, thank you, thank you. Thank you very much for generously sharing your time with us as well as your expertise. We look forward to learning from both of you throughout this session. Once again, welcome everybody, and let's make the most of this opportunity to learn together. By the way, the moderator for the entire session is Marco Barracchia, and he will introduce our speakers as we go on with our event. He will also be facilitating or moderating the Q&A sessions. Once again, welcome and thank you very much. The mic is yours, Marco.
Hello. Thank you. Thank you so much for the introduction. And yes, I have a short presentation that I'm going to share, which is just an introduction of the topic of HIV and STI prevention and combination prevention. And we'll move into Marco's session on specifically vaccinations and the case study of Lombardia, and Eliane's work, community work, and with a special focus on key populations. So when we're talking about HIV prevention and sexual health, it's important as public health experts, but also community advocates, to understand what has worked and what didn't work in the past. And usually programs that favor public health priorities over discriminatory approaches are making the progress in different aspects of the HIV and STI response. We have some countries globally that are making the stride in trying to end the AIDS epidemic, but also reduce new HIV and STI infections. And what we see more and more is the improvements in HIV response contributing to strengthening community health systems and improving the individual lives of people. And countries that are also taking, from a political government perspective, the responsibility to address these issues are also actually making progress in reaching the SDGs. Some countries that have in the past, recently, for example, achieved or almost achieved the 95 targets are Thailand, and what we see is that that was also because of kind of like an integrated approach for stigma reduction and discrimination response into national HIV efforts. After the introduction of the antiretroviral therapy, but also it's important to underline how that kind of introduction and availability of ART and also the biomedical science was really pushed by community organizations. We've seen a decrease in AIDS-related deaths, but also a lot of over 20 million AIDS-related deaths have been averted. Efforts to end AIDS as a public health threat, as we've seen, actually concentrate on eradicating inequities and injustices, forge institutions that serve the public good, but also build dynamic and resilient communities. As we've seen in in our work in public health, specifically in HIV and sexual and reproductive health, is that youth are often the most vulnerable, contributing to one of the major barriers, especially for adolescent girls and young women, which face extraordinarily high HIV risks, also because of structural inequities, gender inequities, violence, and stigma. We were just talking about barriers, the HIV public health prevention programs, and these also include the way the prevention tools are not necessarily reaching the people who need them the most. And these include also biomedical prevention tools such as oral PrEP, the dapivirine vaginal ring, and also access to ART and others across regions. Also, it's important to mention the criminalization and stigma. Many countries still criminalize sex work, drugs, and specific behaviors of key populations, which have a detrimental effect in sexual health and prevention efforts. And in this kind of political climate that we're living now, it's important that we remember how also the treatment gaps and the funding gaps are affecting millions of people. And that's why, because of these barriers, us as public health professionals, but also advocates, we push for what we call combination prevention, or as others have said in the past, the buffet of prevention. So how having a less condom-focused approach to HIV prevention, but also offering all the prevention tools and personalizing interventions based on the needs of the individuals and the communities. And combination prevention programs are rights-based, evidence-informed, and community-owned programs, and have been shown to have the greatest effects. And they work on different levels. In public health, we often talk about this. I'm sure EPH students have seen this model before, but both on the biomedical side, so enhancing biomedical research and access to, for example, pre-exposure prophylaxis, and also when we're talking about biomedical, it's the inclusion of populations that have been systematically and historically marginalized in randomized clinical trials, such as trans women, gender non-conforming individuals, and non-binary people. And also working on the structural levels through interventions that decriminalize sex work, address gender inequities, and so on. And on the behavioral side, interventions that are actually encouraging for peer-based counseling, comprehensive sexuality education, and sexual freedom. These are some of the instruments that we have today to actually prevent HIV and STIs, including antiretroviral therapies, but also ART prevention, injectable PrEP, lenacapavir or cabotegravir, and of course the testing, whether that's HIV testing, STI testing, doxypep, which has raised different concerns in terms of antimicrobial resistance, and that's also a conversation that we can have as people interested in public health, and vaccines, which will be talked more about in the next session. So it's as advocates and people from the community, it's important that we also emphasize the fact that 100% safe sex does not exist. So, but we exist as people, as humans, with our desires to enjoy, to respect our partners, and to actually also have and own that responsibility to take care of ourselves, to know the risks, but also the communities we inhabit and navigate. It's important that public health also emphasizes a more community-based approach, understanding because people from the community are actually the ones that can understand the language, dynamics, and strategies to build safe services. I just wanted to end after a brief introduction, I'm sorry if I spoke too much, on combination prevention, with a collective effort that was recently published through Cornelli Bianchi and PrEP in Italia, And the book Siero Coinvolte, I'm actually a co-author, and the next speaker, Marco Stizioli, is also a co-author through PrEP in Italia. We've actually talked about different challenges and experiences of HIV and PrEP in Italy, and especially highlighting narratives that have been kind of not being represented for a long time, including experiences of people being born with HIV, people with different intersectionalities, and also the, for example, systemic gaps such as the non-reimbursability of PrEP in Italy until 2023. And with that, I wish to introduce Marco Stizioli, who's a passionate advocate for sexual freedom and president of Brescia Checkpoint, the first community-based combination prevention organization in the city. And he is a content creator, trainer, peer educator, and consultant, and works to promote sexual health, reduce HIV stigma, and empower my community. His communities, and I mean our communities. So it's my great pleasure to introduce Marco. And I'm actually going to share the presentation.
Yes, Marco, you have to help me to share the screen because I have technical issues, as they say.
Yes.
So you can also call me Bastian because we are two Mark in the room. So maybe to avoid any confusion, you can call me Bastian. It's not a problem. Marco?
Yes, just give me a second. Okay. I think it should go now. Can you see it?
Yes, okay, it's perfect. Can you move? You just introduced me, so you can move to the next slide. Thank you.
Yes.
So today we are talking about Lombardia vaccination plan for sexual transmitted infection, because I believe it's a good case prevention study. A little background. The Italian healthcare system is universal. This means that everyone has free access to healthcare services. Sometimes you just need to pay a fee for a visit or certain services. We pay taxes, of course. So with this money, the state provides services for people who can afford them. But this is on paper, because in practice there are disparities, especially related to the availability of services. While the Minister of Health sets general rules, the management of healthcare is delegated to the region. This means that we have 20 different regional systems, and some treatment and some healthcare services are available in some region, but not in others. Next slide, please. So we focus on vaccination. We have a national vaccination plan that was updated last year in collaboration between the Ministry of Health and the region. It divides the vaccine into mandatory for children and are always free across the entire Italian territory, like hepatitis B, which has been mandatory since 1990s, and vaccine that are recommended and free for only specific population, but regions are not required to offer this recommended vaccine for free. Next slide, please. I won't go into detail about these STIs, but feel free to ask me any question. For STI, the National Vaccination Plan recommends hepatitis A for people using drug and for MSM, men who have sex with men. This is because in Europe, it's primarily transmitted through anal sex, and there was a small hepatitis A epidemic in Italy, in the Italian MSM community in the last few years. Hepatitis B vaccine is recommended for people using drugs, MSM, people living with HIV, and sex workers. The HPV vaccine is recommended starting at age 11 for everyone, and up to 26 for women, and up to 18 for men. It's also recommended for people living with HIV and for MSM. MSM because for reducing anal cancer risk. As you may know, the meningococcal B vaccine offers partial protection against gonorrhea, but this vaccination plan doesn't mention that. It recommends free vaccination for MMB, for children in the first 2 years of life, and at the age of 11 up to 18, and for people living with HIV. People living with HIV are offered this vaccination for free due to their increased health vulnerabilities. Next slide, please. So Lombardia is in the northern Italy, is a region, and Lombardia is doing better than the national vaccination plan. Last September, the council decided to expand STI vaccination access for more people. Next slide. Beside the population in the next national vaccine plan, Lombardia added for HPV vaccine that is for free for everyone up to 26 years old, so for women, for men, for non-binary people, and so on, but also for sex workers, and also for people for both sexes that have risky sexual behaviors. Next slide. But as we know, HPV can be contracted even without risky behaviors, since condoms don't offer complete protection. But this statement is a good compromise between the political forces that want to save money and those that advocate for universal vaccine access. So in Lombardia, everyone can receive HPV vaccine for free by simply going to a vaccine center and stating they engage in risky sexual behaviors. Next slide, please. About MMB, Lombardia vaccine plan mentioned the partial protection offered against gonorrhea, but it said that for now, there is not enough evidence to offer it for free. Some sexual health clinics already recommend it for people on PrEP or with a history of gonorrhea, but you have to pay out of pocket. Next slide. So in Lombardia, it's simple to have a vaccine. You just go there in a vaccine center without medical prescription, and you declare that you are part of the population for which the vaccine are free for. Next slide. And if you are part of those population, you don't need documents, ID, healthcare card, and so on, or residency to get vaccinated. Next slide. And to expand HPV vaccine, local health departments are working with communities, like in Milan and Pavia with LGBT plus communities, and they are also offering HPV vaccine at the University of Milan and Brescia, and also me with my association, we are working with local authority to start organizing HPV vaccination in our Brescia Pride. Next slide. As I explained, one could simply go to a vaccine center and declare risky behaviors to get the HPV vaccine. However, not everyone feels comfortable doing this. We know our institution can be discriminatory. So, as Brescia Checkpoint, we have decided that our doctor will sign a document stating that the person belongs to a population eligible for the free HPV vaccine. This way, people feel more empowered to go to the vaccine center. While this document doesn't have legal standing, it's still better than nothing. Next slide. So you may think that Lombardia is a kind of healthcare paradise. Of course, it's not. There are many problems. People have reported to us that health providers at the vaccination center actually don't know the latest update of the Lombardia vaccine plan. Furthermore, the Lombardia healthcare system tends to favor private hospitals over public ones. For instance, booking public healthcare appointment can be extremely challenging, with long wait times often exceeding a year. In contrast, private healthcare providers typically offer appointment within a week or two. Finally, by law, the public sector can outsource public health services to private entities. While the national average for such outsourcing is around 20, In Lombardia, this figure is closer to 13. Next slide. So in conclusion, grazie, thank you for your attention. And while Lombardia is making progress with STI vaccination, as I explained, there is still much work to be done. Let's continue to try to offer services at a community-based level because everyone deserves to be protected. Thank you.
Thank you so much, Marco, for your view of your work with Breccia Checkpoint and the case study of Lombardia. I think it's very interesting to actually see how also on the, because in the beginning we talked about the global kind of HIV prevention efforts and country levels, but now we went into more of a regional case study. And I think it's very important to know how both kind of like the Ministry of Health and also the local regions are kind of enacting and implementing this kind of new policies. So thank you so much. And to people in the room, whenever you have questions, feel free to ask them in the chat and we'll try to address them in the Q&A. And as we move forward, I would like to invite Eliane, who I have met at the International AIDS Society and the European AIDS Clinical Society in the past through very community-based and activist spaces. And it was my pleasure for real. And it's our pleasure to have you here today. Just to introduce them, they grew up in Burundi during a turbulent period of the civil war, and they were diagnosed with HIV in 2003. In 2011, they became Dutch citizens, and since 2015, they started sharing their HIV status with the world, and their passion is to make a positive change in the lives of people living with HIV, and especially those with migration backgrounds. As HIV activists, they dream of a world where people living with HIV are healthy citizens, free from stigma, fighting for inequalities together. They say we can help them achieve universal access to health services and empower them to expand their needs, break taboos, and create a stigma-free society. So thank you so much for joining us, and the floor is yours.
Thank you very much for giving me a space to share. I think I'm gonna go for sharing my. So hang on a second, and then can anyone see my? Can you see my screen? Hello?
Not yet.
Yes?
Not yet.
Oh, something went wrong. I have to. A minute. Technique.
I can show it for you if you want, because I have access.
Yes, do that. Yeah.
Okay, don't worry. Can you see the screen?
Wait, I have to go back to.
We can see it.
Yeah, you can see the screen now. Yeah.
Yes.
Wait a minute. From my side or from you?
From me, I think. Because I'm
okay.
sharing. Can you see the slides?
You can see it.
Yeah.
Okay, let me then get out of the sharing and yeah, you are now. Yeah, okay. Okay, thank you very much. So I'm gonna share with you some local-led HIV prevention initiative that I do. I'm involved in. Hopefully, that they can inspire you in your work. Next slide. Well, I start with a personal story. I came in Netherlands wearing this mask, living with HIV already in 2007. This is me in 2007, and this mask represents everybody who's living with HIV but is not open about it because of stigma. Next slide. In 2015, I came out of a closet and I did the HIV nationale campaign called HIV Out of Closet. And I think I was the first migrant woman representing, being also in that national campaign. Next slide. Something happened. I get discriminated in a hospital where I was doing the volunteer work. And I was just, after I came out, then I lose that volunteer work and I start fighting stigma. That's where I dream, like Martin Luther King said, like, wait, you're going fast. Go back. Yes. This is where I have a dream that a world where people living with HIV are healthy citizens and free of stigma, free from stigma. It is really something that is driving me every day to make sure everybody is gonna get that freedom. Next slide. Let me introduce you some of the local action that I do on introducing PrEP diversity. We know it's very, very important to know the prevention and not on always focusing on only men who have sex with men, but women also are more, also we should also give them a space and information. And I am doing for PrEP diversity in different with different organizations. For example, I was with the Sensora organization in Belgium during the Pride, where I just make sure I bring also the awareness on PrEP. Next. This is also another activity on sex workers in Burundi. It's also this is the group that called women, Bawa women. They are in Burundi, but also we are supporting them. Next slide. This is, for example, one of the training days where they are focusing on prevention, giving them training, knowing all different sort of prevention, also specifically on PrEP. And another day here is Awareness Day on PrEP with women. Of course, these are our sex workers, and of course also distributing some female condoms as well. Next. I am also volunteering in a PrEP Nu is only organization we have here in Netherlands, and this is the way we go PrEP outreach team on festivals where you get LGBTQI plus individuals who come for those festivals. Then we are sharing the information and making sure we bring more awareness on PrEP. There is HIV drug activism. This is also me as a drag king, Eric the drag king. Next slide. This is Eric the drag king doing performing, raising HIV awareness, fighting stigma, stamping stigma away. And this is very a good moment also where you meet also people come festivals, and then on stage I share the talent. I also share the message, also encouraging people living with HIV who are also, even if you are still in hiding, but then you get to see that is also very is a positive image of people. They know Eric is living with HIV, so this is also a very another tools that I use also to fight stigma and reach also those individuals from LGBTQI plus foreign. And this is also Eric on PrEP, holding PrEP on catwalk. It is one of the biggest ballroom in Amsterdam, actually, biggest ballroom in Europe. Here is during the Super Bowl, and here you have like more than 1,500 individuals in the room who can see the message about PrEP. So this is also one of the work. So another initiative that is also helping to tackle stigma is the Stories of Hope. And this was also an initiative that started in Amersfoort, is local here in Amersfoort in Netherlands. And during the COVID, we had a safe space where we could just put together what's our talent, and we do creative session, and some stage we did presentation. Next slide. And this is what came out, beautiful presentation with exhibition of the portrait. This was more to show everyone that beautiful image of people living with HIV and sharing our talent to break stigma. And next. And later we put it in international. More other people, also HIV allies, were also now involved in our project Stories of Hope. This is one of the Jennifer Hopeless. Is a very drug activist, and he's also the one of who started the PrEP in Amsterdam, who also co-founder of PrEP Nu, the organization that I was talking about. She's also the one who introduced Eric the Drag King, me, in the drag family. And with all about sharing the talent to break HIV stigma. Next. Where we talk about also on global stage, how do we bring the activism, and I think like everything I learn, every experience I see in a community, I can be able to bring it on table, or bring it on stage and discuss, or other is doing the panel, or those are the also work that is very important also to make sure to bring the voices wherever you have opportunity to bring what is bothering the community, what do we want, how can we change things. So this is me again on a global stage discussing. Next time, Serge. And here we are, in global stage, also matching, demanding the access for all for HIV medication or for treatment for all, and also demanding also PrEP access also for prevention. Those are the two things that are very important for also HIV community. And thank you again. This is me. Thank you.
Thank you so much for your presentation. I think it gave also a very good visual representation of your work. So thank you so much. And wait, can you? Yeah, I stopped sharing, right? Yes. Okay, so we have some questions in the room that we can try to address. So the first one would be, do regional case studies help in advocating for increase in national funding towards the particular health concern? Could you comment on the with regards to Lombardia and Italy? Thanks.
I think this is for me. So I think that the case study can help us to. Case studies are inspiration for other cities, for other associations like Brescia Checkpoint. We decided to establish Brescia Checkpoint because we were inspired by other community lead association, HIV community lead association in Italy, like Milano Checkpoint, Bologna Checkpoint, Rome Checkpoint. So we take the inspiration, but I don't believe that a local regional case study can help also in the context of Italy, that every region thinks for itself. So, but I think that we should, as association, Italian association, think in the local, but also have more a wider vision and help and give input and spread information also to other associations in all across Italy.
Thank you. Yes, and I also believe that you can push from a community side for your region to do something, and then doing collective efforts with other regions to then maybe influence on a national level. So what we did in Italy was kind of pushing from a regional and local base for the reimbursability of PrEP, and then in the end, it was reimbursed into 2023. So that's kind of like an example. And a question to Eliane, I believe. What inspired you to use performance for STI or HIV prevention?
I have to go back to, I grew up in a war zone, and as an artist, I'm an artist, and we used to use the music and dance to promote a piece. So I know every time you have art is a powerful tool to educate people. So when people are coming to watch me performing, it's a very good opportunity for me to introduce, like to promote the prevention, and then the same time they are watching you and they go back, they get message goes come very easy to them than when you can call them to go somewhere on the field and talk to them without entertaining. So it's very, and it works all the time. It works. So yes, thanks.
Thank you, Eliane. And is injectable PrEP available in every hospital in Italy? And then there's also another question about injectable, with what's the difference between the oral and the injectable PrEP?
Okay, the injectable PrEP, called also cabotegravir, is not available in every hospital because it's not free now. There are some pilot projects we can call, because the drug is authorized, but it's very expensive. So there are just pilot project in Rome and Milano, and they are starting with this project, and now we will see what our national medicine agency will decide, if the agency will decide for reimbursement or not. So for the moment, there are just 4 pilot projects. Of course, it's safe, the new injectable PrEP, cabotegravir, and also lenacapavir, but is not authorized yet, lenacapavir. It's safe. I had the first shot 2 weeks ago, and I'm here, so it's safe. And the difference is that with the injectable, you don't need to remember to take the pill, and also you are ready to go. If you want to have sex with the pill, sometimes you have to take before, and so on.
Yeah.
And also, I guess the is not so stressful for the body. How can you help me to translate, Marco? Like
it's not overwhelming, or it's not
yes,
like like it doesn't really have a secondary
yes,
effect.
but it's like this. It doesn't have a strong side effect, but also oral PrEP doesn't have. But cabotegravir in this is much better, I believe.
Just to make a different, like just for those who are not super experienced, cabotegravir, it's an injection every 2 months, and lenacapavir, which hasn't been approved, but Gilead actually asked for the market access authorization in Europe recently, and we hope that soon, but we know the times of the EU. So hopefully soon it will be available for people. And other reasons why the injectable PrEP work better, or might work better in specific communities, is, as Marco was saying, you don't really have to remember to take the pill every day. So let's think of sex workers, people who have kind of like times of the day that don't really fit in actually taking and remembering to take a pill, or people who cannot negotiate the condom always, people who are constantly on the move and migrating. So we think that lenacapavir and cabotegravir should be approved as soon as possible and widely available to different regions. So yes. And I think there's a a question to Eliane. What has been the most impactful reaction to your shows? It's been super inspiring hearing you.
Well, my shows is as Eric the Drag King, you get more sometimes also individuals approach me and talk to me about the family members or themselves come out the closet like, I'm also living with HIV. Super cool what you did there on the show, because mostly I am wearing a red ribbon and then I take out the PrEP diversity flag from my, I open the zip of my trousers and then I take it out like like surprise, and then there is a message. Then also the African music I dance normally, it's like with the, how African moves is very is super energetic, and then it always gives like say inspiration to people. Say like they have this kind of image of people living with HIV, how would look like we're supposed to behave. Then that change exactly. So I see the change, the way people approach me. I see the change that is stigma is being reduced the moment also you tell like this is me, and then they come to you, hug you, and talk to you like, yeah, the story. I like that, and I see it's a change. So
yeah, and I mean, if you have a chance, you can follow them on social media and maybe go
Eric the Drag King.
Eric the Drag King, yes.
I write it in a chat so you can.
Yes, thank you. And also to Marco, both of you, are you planning to have more podcasts like this? One, to spread awareness about these topics. I believe it's important not only for LGBT communities, but also for all of us. And I think,
yeah, if you can find a sponsor, because doing all this stuff for free sometimes is not well. We have
You're right, Marco. Activism is very cheap, but it's not very
I know,
cheap.
but sometimes. But no, if you need any kind of information, I guess you can write to me, to Eliane, to Marco, the other one, and we will share the information. Who knows? Maybe in the future we can have a podcast all together.
Yes, and also to the point that it's important not only for LGBT communities, but for all of us. I think it's very important. And Marco and I are currently kind of doing a community-based research to actually address what are the barriers for cisgender, heterosexual, also women, for example, who are very kind of out of the HIV and STI conversation, because there's this societal perception that HIV and STIs are only for promiscuous LGBT individuals. But I mean, that's also a taboo that we're trying to deconstruct, and actually addressing the needs from a more intersectional perspective and inclusive. So yes. And a last question, is there any study conducted to correlate the out-of-pocket expenses on access to sexual reproductive health services and information? It'd be better if we could address based on our experiences. So maybe Marco, based also on your
as far as I know, in Lombardia there are not this kind of study, so it's a good idea to start to study this. But no, as far as I know, there are no studies about this. I'm sorry. So I don't know, Marco, if you know something. But
yeah, there's been I think I remember a systematic literature review on like out-of-pocket pocket expenses. I mean, I'm not sure, like I can't remember now. We can look for it and like send it to you. But it was like the every dollar spent on STI and HIV prevention efforts would diminish, new infections by a percentage. I can't remember, but I mean, it's been studied, not specifically in Lombardia or Italy, but it's been studied, and we know. And we also know from a kind of like community perspective, then when more people know about these instruments, when more people know about combination prevention in the community, then it's just like a safer space, and people actually take advantage of these instruments, whether that's daily PrEP or CAB or even just getting tested. And I think that's something that we're trying to do more and more. So yeah.
Hello, Marco.
Yes.
Yes. I also received 2 questions. These questions are not addressed to a specific person, but I think any of you three can answer them. Let me read. The first is, what do you think has driven the key achievements in the fight against HIV in recent years? And the other question is, based on your experience, what strategies have been most effective in reducing stigma and promoting testing, PrEP, and treatment among adolescents? I think this is relevant because we've seen increasing cases of HIV among younger populations.
Can you repeat? Yes, can you repeat, please, the 2 questions? Sorry.
Or maybe if you can copy paste them in the chat, it would be
Yes.
also for speakers.
Yes.
I'll send them to you also.
Yes, if Eliane or Marco want to answer. I need to shut up for a bit, so help me.
I cannot. Where is the question?
Okay, in the chat. For adolescents, is not in Italy. Is not possible to not almost anything, but like in Italy, is not possible for people younger than 18 get tested by themselves. They can go get an HIV test with the parents, but not with themselves. Also, it's very difficult in Italy have a sexual education at school. It's not mandatory, and the parents a lot of time don't want that their teenager children have a sexual education at school. So adolescence in Italy is a huge problem. Also, it's not possible for adolescents have PrEP. So we don't have a lot of strategies. If we are lucky if we can have just 1 hour of sexual education at school. With my association, we start to have sexual education at school, but in an hour, you can say anything. So we talk in general about something, but no, it's a problem. But for people a little younger, you can start to create community-based initiative like spreading condom, like HIV testing, and so on.
Yeah, thank you. Yeah, and also in Italy is not mandatory sexual education, and that's kind of like not great. And other 2 things that came to my mind are also social media, and we're seeing for example, having like an online presence or using social media, and also yeah, for example, Grindr, Tinder, these spaces are also venues to raise awareness on sexual education. And some countries, such as France, are also trying to give PrEP also for minors, even if they're not accompanied by their parents, but by adults. So that's kind of like changing the landscape for adolescents and younger populations, but that's not still the case in Italy.
In the Netherlands, we are still far away to reach to the adolescents for PrEP, because it started as a pilot for 3 years for the gay men who have sex with men, and since August last year, it was like is a PrEP for everyone, but you have to buy it for yourself. So now you can see there is no way. We are still fighting, try to convince that the Minister of Health to change, to make sure they put it also on insurance, that then they can get access for free. But it's not, we are not there yet. So we cannot even, HIV education at schools for adolescents is not really something that is happening also. So it's supposed to happen, but we have this government with a lot of conservative and religious people who are standing on the way. So to educate actually a young adolescent, it's still a little bit of pain in us. Sorry, a problem to do. But let's say. Unless parents take their own initiative to teach them their kids at home something. But yeah, I would say like my kids, they know about PrEP. 18 and 16 years old boys, they know about PrEP because I know it's very important for them to know. But if they need it, it's another story. But then what we do, even promotion, national campaign to promote condoms, is not done for last 10 years. So recently they published that young gay boys HIV is rising up because there is no such promotion is not done already for 10 years already. So I keep saying, what are we waiting for? So this is exactly, we are not really so much. Actually, I congratulate Italy. You guys, you are doing good job. Seriously, I'm so proud of you. Yeah.
There's still things to be done, and there's a conversation running now on like also the government changes and things are changing, not always for better. But I mean, yeah, like the road is long, and someone is also asking if there are free sex education websites. We can put in the in the chat a couple of like links or names that you can look at. You can also look at the International AIDS Society. They have a specific section on free courses on HIV and STI prevention and treatment, where you can also do free of charge courses, register, having, you know, like also certificates sometimes, and also sources like AVAC, PrEP Watch are also updated databases and websites to consult if you're interested. Okay, so unless I missed any other question, I mean, there's people commenting on the importance of this, the beautiful work that Eliane is doing, and the importance of also raising awareness on sexual education amongst schools, families, and peers. And I think spaces like this are a starting point in terms of how do we actually, you know, pass this information in the communities we navigate, whether that's in our family or friends. So, and also having more open conversation on just like sex and sexuality and sexual freedom. I think it's something that we're trying to also normalize, and we see more and more also with the younger populations. It's sometimes hard because we don't have sometimes the vocabulary and language to express our feelings. So yes, is there any other comment the other speakers want to make, or if anyone has questions and wants to join also with their voice, feel free. Otherwise, we can call it an end.
I want to say something.
Yes.
Just tips. Sometimes people, they tend to think like, oh, sex is something dirty, or especially when they are trying to judge people living with HIV. I always tell them like, well, remember, if you were born because your parents did have sex, so sex is not something dirty. Everyone loves sex, even priests, they love sex. So we are living here because our parents managed to have sex. That's why we are born. So it should not be something to be ashamed of. So thanks.
Yes, and also it's important to emphasize the U equals U. That's been kindly mentioned before, but undetectable equals untransmissible. So even if you're a person living with HIV, had you into antiretroviral therapy, you cannot 100% transmit the virus, even if you engage with unprotected sex. So sex is safe and can be safe or safer if we have this type of information available. And with that, I think we're good to end the session and the webinar. Thank you. So many people joined for being like at 6 p.m. on a Wednesday. There were like over 35 people at some point. So thank you so much. And we hope to have more of these conversations. And thanks EPHSA for giving us this space and allowing us to share a bit of our experiences and passion. Thank you. And thanks everyone.
So much. Ciao.
Thank you very much. Ciao.
Bye
Bye-bye.
Thank
Bye.
Thanks everyone. Ciao, ciao.
Ciao.